For that, very, very important to understand because there has been zero, nada longitudinal long-term studies as far as the impact as what this shot can do to not just you, but most importantly, our kids. So I want to play a clip for you here. We got a lot to get to today, but earlier today, Saint Fauci. Yes, Saint Fauci. He was up on the Hill, and I always love, thank goodness for Senator Rand Paul. I always love when Senator or Dr. Rand Paul sit down and Dr. Fauci go at it up on the Hill. Listen closely here, okay? Because you and I have been told, follow the science. Quit being a bunch of rubes and just follow the science. It's that easy. Because if you follow the science, then clearly all the stuff that we are psyoping you with, psychological operation, if you're new to the show, all the stuff that we're psyoping you with makes total sense. Just follow the science. Here's Senator Rand Paul and Dr. Fauci talking about the science.
Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?
Right now, there's not enough data that has been accumulated, Senator Paul, to indicate that that's the case. I believe that the recommendation that was made was based on the assumption that if you look at the morbidity and mortality of children within each of the age groups, 0 to 5, 5 to 11.
Right. So there are no studies, and Americans should all know this. There are no studies on children showing a reduction in hospitalization or death with taking a booster. The only studies that were permitted, the only studies that were presented were antibody studies.
Please take a moment to digest. You and I, ad nauseum, have been told to follow the science. We had the President of the United States stand up on September 9th, 2021, and say to you, if you took the shot, I totally understand how you can be frustrated, essentially, with these rubes that have not taken the shot. And yet, let's just be clear here, we are talking about our kids. Have you seen the young athletes out on the fields, the courts just collapsing, falling over? Why is that happening? There was a young woman here in Fargo. I'm not going to make any assertions, so I'm not going to try to link these things because nobody in the media here is willing to ask the question, but a young woman, 23 years old, had a stroke. When's the last time you heard of a 23-year-old having a stroke? I don't know if she took the shot or not. I don't know if she took the booster or not. All I'm saying is it's obviously an anomaly. It's an aberration. It's a little strange. And yet you and I are said, hey, follow the science. And now the truth is coming out in the fact that, guess what? There is no science. Kids 5 and older being told by the FDA, the CDC, people that we are told to trust, i.e. the government. Hopefully people are waking up because this show is media sources, most elected officials telling you, hey, follow the science. And guess what? There is none.
So they say if we give you a booster, you make antibodies. Now, a lot of scientists would question whether or not that's proof of efficacy of a vaccine. If I give you 10, or if I give a patient 10 mRNA vaccines and they make protein each time, or they make antibody each time, is that proof that we should give 10 boosters, Dr. Fauci?
No, I think that is somewhat of an absurd exaggeration.
Well, that is the proof that you use. Your committees use that. That's the only proof you have to tell children to take a booster is that they make antibodies. So it's not an absurdity. You're already at like 5 boosters for people. You've had, 2 or 3 boosters. It's like, where is the proof? Now, I think there is probably some indication for older folks that have some risk factors. For younger folks, there's...
Listen closely here. Again, remember what I just mentioned about how many times have you seen young people? I mean, these are athletes. Right? People that are well-conditioned, in great shape, running down the court, running on the field, collapse.
Not. But here's the other thing. There are some risk factors for the vaccine. So the risk of myocarditis with a second dose for adolescent boys 12 to 24 is about 80 in a million. This is both from the CDC and from the Israeli study. It's also in the VAERS study, remarkably similar for boys, much higher from boys than girls and much higher than the background. The background's about 2 per million. So there is risk and there are risks. And you're telling everybody in America just blindly go out there because we made antibodies. So it is not an absurd corollary to say if you have 10. In fact, you probably make antibodies if you get 100 boosters. All right. That's not science. That's conjecture. And we should not be making public policy on it.
So, Senator Paul, if I might respond to that, we just heard in his opening statement, Ranking Member Burr talk about his staff who went to Israel. And if you look at the data from Israel, the boosts, both the third shot boost and the fourth shot boost, was associated with a clear-cut clinical effect, mostly in elderly people, but also as they gathered more data, even in people in the 40s and the 50s. So there is clinical data.
But it's not
In children.
Thank you.
Well,
See,
again,
here's the thing is you're not willing to be honest with the American people. So, for example, 75% of kids have had the disease. Why is the CDC not including this in the data?
This is amazing.
You can ask the question. You can do laboratory tests to find out who's had it and who hasn't had the disease. What is the incidence of hospitalization and death for children who've been infected with COVID, subsequently going to the hospital or dying? What is the possibility if your kid has had COVID, which is 75% of the country's had COVID, what is the chance that my child's going to the hospital or dying?
if you look at the number of deaths in pediatrics, Senator, you can see that there are more deaths
Of
in
people who have had it,
pediatrics.
of people who have had the
Pediatric-
disease.
Senator, we also know from other studies that the optimal degree of protection when you get infection is to get vaccinated after infection. And in fact, showing reinfection in the era of Omicron and the sublineages, that vaccination.
But you can't
follows-
answer the question I asked. The question I ask is how many kids are dying and how many kids are going to the hospital who've already had COVID?
Please, please, please understand what is happening here. Months ago, we came on this show and I said, look, if you were going to determine a successful United States of America and the war on COVID, what's the number one most important metric you would focus on? And what's the second most important metric you'd focus on? Because they continue to tell you, hey, take this shot that we don't really even know what it's going to do. We haven't really done any longitudinal studies, but just take it because we want to save lives. And yet here you have Senator Rand Paul asking the top doctor in the nation, the highest paid employee in our entire government, making 400 G's a year, being asked a very simple question because we are told, hey, the United States of America is successful now that Joe Biden's in the chair. We've got a great fight against COVID. And he's asking him a very simple metric that every single person in the NIH and the CDC and the FDA should absolutely know, because the only two things that matter when it comes to measuring your success to COVID is what's the death rate and what's the hospitalization rate. That's it. Other than that, many people have gotten COVID. They've had flu-type symptoms. We can go on and on down the list. Those are the two things that matter in order to save lives and make sure we've got enough hospital space. And the highest paid person in the United States government who should know this in his sleep can't answer that very simple question.
The answer may be zero, but you're not even giving us the data because you have so much wanted to protect everybody from all the data because we're not smart enough to look at the data. When you released data earlier, when the CDC released the data, they left out the category of 18 to 49 on whether or not there was a health benefit for adults 18 to 49. Why was it left out? When critics finally complained, it was finally included because there was no health benefit from taking a booster between the 18 to 49 and the CDC study. Another question for
18 to 49-year-olds, no health benefit from taking the booster. Do we even know anymore? What does it mean to be fully vaccinated? I haven't heard that term forever. Does anybody know what it means to be fully vaccinated anymore? If you know, please email the show. It's studio@chrisbergshow.com. Again, studio@chrisbergshow.com. Is it 2 shots? Is it 2 shots and 4 boosters? I mean, you just heard Fauci say there, which I think that was another piece I wanted to chat about is, hey, we went to Israel. We looked at the data in Israel. Okay, super producer Chris Larson says he knows. 1 second. We looked at the data in Israel, and the people that had 3 and 4 what? If this vaccine is so effective, why do I need 3 or 4 booster shots? So I just hope, I pray that I am an effective enough communicator that you can hear what's happening here about they're coming after your kids. They are telling you your kids need to take a shot. Remember, there was a time, I believe, in Seattle. In fact, if I remember this correctly, I hope I do, there was a mom that passed away, and I think it was suicide or something to that effect, because remember, she couldn't go to her daughter's school because she wasn't vaccinated. And now we're hearing that, look, there's absolutely no impact. We'd have no idea what the data is for kids 5 and above when it comes to taking a booster shot. And I know that's different than being vaccinated, and you get my point.